Anterior chamber angle assessment is an important part of ocular examination. One of the ways of conducting this is Van Herick's technique, which assesses the angle. Another useful technique is Smith's method, which allows us to estimate the anterior chamber depth at the apex of the cornea. Smith's method is useful in conjunction with Van Herick's technique to get an overall idea of the anterior chamber geometry. This is so that we can determine, for example, if it is safe to dilate the pupil, or if the patient might be at risk of angle closure glaucoma. In order to conduct Smith's method, we begin by forming a clear section of the cornea, as we have here. Once we have this, we need to increase the angle between the observation and illumination system to exactly 60 degrees. Once the cornea is sharply in focus again, we need to turn the slit by 90 degrees, as shown here. What this will now mean is that the control for the width of the slit will adjust the apparent height of the slit, as we can see here. The knob that used to control the height will now control the length of the slit. So we can see here that as we alter the slit height knob, it is the length of the beam of light that increases and decreases. Because we have a slit formed on the cornea and also on the lens and iris, both of these change and their separation also changes. We now need to focus the horizontal beams clearly, whilst using moderate magnification, about 16 times, to see both the beam on the cornea and on the lens and iris. By adjusting the height control, we need to make the two beams come together at the very centre of the pupil. Here we've outlined the two images, and you can see that they are slightly separated. What we need to do now, whilst observing using the right eyepiece for the patient's right eye and with the left eyepiece for the patient's left eye, is to increase the height of the slit until the two just touch at the centre of the pupil. We can see here diagrammatically what we've achieved. We have the scatter of light off the cornea to form the image on the cornea, and then the light carries on through and strikes the lens and iris, creating the image of the lens and iris. We now increase the height of the slit until the two images just meet at the very centre or the apex of the cornea. We can see that we've achieved this here. Remember, when we're examining the patient's right eye, we need to use just the right eyepiece, and when we're examining the patient's left eye, we use just the left eyepiece. At this point, when the two horizontal beams just touch, we read the length of the image off the scale, and we need to multiply that value by 1.31. This product will give you an approximation of the depth of the anterior chamber at the centre of the cornea. If the anterior chamber depth is greater than 2.8 millimeters, the depth is said to be open. If it is less than this, it is deemed to be shallow.